Welcome. I'm Dr. Vinay Prasad. I'm a hematologist-oncologist, and I'm Associate Professor of Medicine at the University of California, San Francisco. In my professional life, I see patients, I teach trainees, and I do research in healthcare policy. This is Plenary Session. Plenary Session is a podcast at the intersection of medicine, oncology, and health policy, and you're listening to Season 3. On this week's episode. This week on Plenary Session, I'm joined by Sosin. She is a researcher at the Dartmouth Medical School, and she's here to talk about the secrets of Vermont in taming the COVID-19 pandemic. If you like this podcast and want more content, follow me on Twitter at vprasadmdmph. Check out the YouTube channel, Vinay Prasad, MD-MPH. Patreon backers will get access to the slides for lectures I give on Plenary Session. Want to hear from us? Email us your question at plenarysessionpodcast@gmail.com. I'm back in Plenary Session, joined via Zoom by friend of the podcast, Sosin. Sosin is a researcher based out of Vermont and Dartmouth. And she is a prior guest of this podcast where she talked about the unique success and challenges faced in a small northeastern state like Vermont. And it's a pleasure to have you back on the show.
Thanks for having me back on the show.
Since we've been off, I hear a lot of talk of Vermont. Vermont is being hailed as like the greatest exception to this country, in the sense that you all invested in, it wasn't just about restrictions, it was about investments. And that's been sort of a core theme about the success of Vermont. I wonder if you might talk a little bit about, there's no real success when it comes to a pandemic, but you fared better than most. So what does it mean to have succeeded? And what were the investments that were thought to have played a role?
Sure. Thanks for that question. I think Vermont offers a lot of lessons on how to approach a pandemic. And let me talk through just a few of the things that we're learning right now. Obviously we can see that Vermont has led the country consistently at low rates of infection, and many believe that it's something that just happened, that the state got lucky, that it was a result of the state being rural, and what our research really shows is that there are key strengths in the state, but there are real lessons that can translate out to other settings. And let me talk briefly about some of those lessons. Yeah. So one thing that Vermont recognized is that it needed to figure out how to manage the pandemic. And by that, it adopted what I would describe as a phased approach to the pandemic. Many states succeeded in averting high rates of infection early on, only to see resurgences later. And Vermont defined a clear phased approach to the pandemic, and with a real focus on that post-shutdown period. During the shutdown, it scaled up testing and contact tracing, but it also really thought, how do we sustain these behavior changes over time? And it was able to do that very successfully through the summer and into the fall, even as other states had resurgences. I think the second lesson that we've learned is that Vermont has prioritized its most vulnerable populations from the start of the pandemic. We know that COVID-19 selects preferentially for the poor, as Paul Farmer has said. We know that, it's our essential workforce, it's our residents of nursing homes, prisons, and other congregate living settings that have, seen higher rates of infection and mortality. And yet most of the states have not prioritized these populations in their approach. Vermont has had a number of policies, programs, and strategies to target these populations. It housed its homeless populations using an expanded form of its motel voucher system.
So that's a big one. I wonder if you could go into that for a second. So homeless population was given housing. That's important.
It's really important. There are rates of infection up to 66% that have been documented in homeless populations. And it's because we know that, their social distancing is not possible in a crowded shelter environment. What Vermont did is it expanded its existing motel voucher program. It housed many homeless people in motels, and then social service organizations and community groups provided nutritional support. They provided other social services so that their needs were met. So it was really a partnership that was led by the state, but supported by the social service sector. And Vermont has to date documented, to my knowledge, only 6 cases of COVID-19 in its homeless population, and that's a stark difference, I think, from what we've seen elsewhere. I think, but the differences don't stop there. We know that there's a clear link between housing and COVID-19.
Yes.
Vermont has had an eviction moratorium in place. Mm-hmm. And what we're starting to see in the state of Vermont is that that's not only highly protective against COVID-19, but there are also other positive outcomes. So it's been a sort of natural experiment of what happens when you do the right things and you address those social determinants of health.
Yes.
Vermont has targeted its testing to rural communities rather than having sites that are inaccessible to rural locations where transportation represents a major barrier to healthcare. Anytime there's been an outbreak, the state has brought testing to those communities, and it's paired that testing with really targeted support for those communities. There was an outbreak at an apple orchard. The state brought in nutritional assistance to ensure that those the workers that were there could isolate. There have been other outbreaks, and so the support has been really directed at the very specific needs of the communities that were affected. And we've seen, over and over again that this, it's not simply a matter of prioritizing, but identifying what are the specific needs and how can we meet them with the resources we have. So that's a second, that's a second lesson from Vermont. I think the third thing that the state has done really well is it's targeted or it's developed policy responses to offset what we know are the secondary impacts of those restrictions. We know that restrictions have, economic impacts, that businesses suffer, that workers suffer, and the state has used its CARES Act funding to target the most effective sectors of the economy. This not only has helped businesses through, but I think it's increased tolerance for these restrictions, and it's been really critical to sustaining success over time. And it's not something that we talk about very often, but we know that there's been an erosion of support in many places because of the impacts of these measures on the economy. And I'm really hopeful that, as we look ahead, to a reset of the pandemic, come late January, that there'll be real attention to what kind of economic relief do we need to put in place, to make, these measures, work better. I think the fourth thing that has been really effectively done in the state of Vermont also is the use of messaging. Messaging is not a substitute for good public health, but it's critical to enlisting a population, in a public health response. And the state has, always conveyed the sense of hope and agency, in telling communities your actions matter. Yes. And through, the collective sacrifices of this population, we're going to achieve, meaningful goals. And those goals go beyond simply not packing ICUs or not, having outbreaks in our nursing homes. These goals are, we're going to keep our schools open. We're going to protect our businesses. We're going to ensure, some sort of social continuity throughout this pandemic. And I think that's made a real difference in terms of how the state has done, in the state's overall performance. I think the fifth lesson that I'll highlight is that the state has there's been quite a bit of adaptation of good guidance to local context. There's a great deal of specificity. We have good scientific evidence now on some questions, but then we need to think about how do we actually implement that at state level, at regional level, at community level in a way that is really going to work. And I think one of the failures of the pandemic response nationally has been there's been a lot of attention on these key scientific questions without a lot of thought about how do we translate that down into a real world setting. And we see, so much specificity in terms of how the state has approached the challenges that it's seen, across various communities.
Those are so many excellent points. I mean, investing in secure housing, my understanding was, I looked at it once a long time ago, and it was like something like $11,000 per person per year. And when you think about how much we spend in healthcare and how $11,000 like one ED visit practically, that something like that can just pay for itself. And in the case of a pandemic, clearly a key thing. And then the other thing you said that just really strikes me as just super rational is keeping people invested has been very difficult. Keeping people motivated to push on, to follow precautions that we believe are sensible. And that investment is strengthened when people feel like they're getting something back for it. And in your case, the schools being open. I think there have been, one of the frustrations about the school closures, I think, and there's a recent meta-analysis that shows this, if you like zoom out on the world and look at school closures, the relationship between local case rates and schools being open and closed, it's like a coin flip. It has nothing to do with the other. And that is frustrating, I think, to many people who watch this and see that it's just sort of this tribal fight. But in a place like Vermont, you merge those two things together and you say that as long as we're able to keep this virus under control, we can have the schools opening, and that's a great good for all of us, and certainly for many people who have got kids of that age. I'm sure that they would be strong believers in that and be willing to do some of these harder things.
Yes, definitely. What I would say is that schools have emerged as key leaders in the public health response in this state. And
Wow.
let me explain what I mean by that. You know, when schools reopened, there was a call from leadership across the state to communities to take actions to reopen schools, to keep teachers and students safe. And it was school superintendents, it was school principals and others saying, these are the things that we need you to do for us to be able to keep our schools open. You know, and the schools have all actually played a really important role in terms of accountability for some of the public health measures in place. Their mechanism, you know, they act as a mechanism for enforcing or implementing some of those measures. And families want to do that because schools are so valuable to them. They keep a workforce running. They keep the economy running. And as families understand that, the school closures have enormous impacts, on their children's well-being. So they've been, I think that role that schools actually play or can potentially play in stemming transmission has really been underappreciated or underexplored in many settings.
You're somebody who is also on social media, although you're very quiet. You don't say too much. You're smiling in acknowledgement that I'm saying something true. If you were to reflect on, I think, you made this point that communication is important. Of course, communication alone won't stop a virus, but communication is key. And here you are, at least a consumer of, I think, international communication. Where do you see the deficits? Where do you see the strengths? I mean, when you look on Twitter, I imagine sometimes you cringe and you say, oh gosh, that's not how I would do it. I wouldn't say it that way. That's not unlikely to be successful. Sometimes you may see something that you really resonates with you. I'm wondering if you might articulate, what are the things that get you concerned?
It's a great question. As someone who's engaged sort of in community-based research or research that's not biomedical, sometimes I worry that there's an underrepresentation of, other disciplines, other methods, other approaches. And I wish that, I think that there's been a privileging of certain disciplines over other disciplines. Yes. And it's really important for us to think, how can we collaborate across disciplines? We need really robust biomedical research, but we also need really strong social sciences to go along with it. We are going to have, or we have a vaccine now. Now we really need to think about, how are we going to deliver that? That's going to require, different forms of research. How are we going to overcome some of the barriers, including vaccine hesitancy? And that's going to require a call to a range of other disciplines. And so I think we need to rather than fight about epistemic boundaries, I think we need to think, how do we collaborate productively across those boundaries, recognizing, that we have shared goals and vaccinating the population. So I think Twitter sometimes can fragment, those debates in unproductive ways. That said, I think, social media can also give rise to collaborations. There can be productive networking, or at least my experience has been that it's been a place to connect with others who are thinking about similar ideas.
Yeah, I think that's well put. We hear the whole range of views on social media, from the ED doctors to the ID doctors, and that's really the whole.
I think one of the things that concerns me with social media is that it's become a platform for shaming, and I don't think that shame is an effective strategy in public health. I think we have no evidence that supports shame as being the as an approach, but
go on with that. Like some examples of that would be a photo of people meeting, dinner party, or the beach photos from the summer, or I think I don't know. I guess I was troubled a little bit around the holiday, and I think I'm going to be troubled again very shortly. Is I guess shaming to me is certainly among strategies that I don't think are persuasive. The other thing is, like, I'm not necessarily sure if the right strategy is yelling louder or trying to scare people. You're shaking your head no. Because, like, the one thing I notice is, I guess I was struck by that poll around Thanksgiving time that I think one of these newspapers put out, where they said 38% of Americans plan to meet with at least 10 or more relatives, and I don't know, only a third would ask their relatives to wear masks or something like that. They put out that poll. And I almost felt like the way they wrote the headline was to kind of get the goat of doctors and get the doctors to, like, retweet it. Like, it was a clickbait to, like, get your outrage. And I really worry that, like, so much of all messaging is trying to get it's hard to get people interested in what you're saying unless you really anger them. So, like, it's like provocative stuff. So I wonder if this was just in that sense. But when I read that poll, of course, I'm really saddened by it. Like, what does it tell you? It tells you that, like, people are really lonely and suffering, that they're saying that even though all we're talking about is COVID-19 all year, 38% of them still want to meet their loved ones, and they, like, haven't seen, like, parents. And I think the other thing about it is that's hard to express to people in different countries is in a lot of countries, like the country my parents are from, children and parents can, like, live together for, like, their entire lives. But in the United States, for some of us, the only time we ever see our parents is Thanksgiving. It just has a different meaning in the United States than it does in other places around the world where people are much closer. People move to different cities, thousands of miles away. So when I saw that poll, I actually felt sad. And I felt really sad because I think people were telling you something about how they really feel. Because, of course, all the incentives of the poll would be to, like, minimize that number, not to, to say it. And so one of the responses was people were like, well, the ICUs are overflowing and the hospitals are overworked. And I think that those are true, but that's unlikely to have valence on somebody who is saying this right now. And I think shame was another popular tactic, and anger. And I ended up writing an article saying, like, we need to think of ways to, like, have a meet up, but less risk. And I'm working on a new one for Christmas where I'm going to have some more suggestions. But I got a lot of blowback my way and it included some of that epistemic trespassing that you talked about, which was somebody said that I wasn't a public health expert, and then I looked on my wall at that MPH I have from Hopkins Bloomberg School of Public Health, and a tear went down my cheek because it's the only time. I was like, they never give anything to me. I was like, finally that MPH has come in handy, and I won't get the credit. And then of course I'm not an ID doctor, I'm not a critical care doctor, I'm a different doctor, and of course anyone can say that about anyone because there's no amount of credentials one could have unless you're Saint Anthony of Fauci. But even then, I'm sure there's someone will knock him for something. But anyway, the point of this tirade is to say, I guess I am troubled by that messaging that is not empathetic to what people are telling you. And I wonder if you might talk about what does empathetic messaging look like?
Sure. I guess I want to start by saying that people are the experts of their own lives. We all bring our expertise to this work, but we're not the experts of, individuals' lives. We're not the experts of communities' experiences. And, in my work, it's really important to sit and understand the experiences of communities, because I think that's our starting point for beginning to developing messaging and approaches to working within those communities. And we know that social connection is a basic human need. And if we start from that point and start to think about how do we reduce the risk of meeting that need,
Yes.
how do we structure safer alternatives for social connection, it's going to get us a lot further, not only in our approach to messaging, but in the public health strategies that we're developing. Sometimes I think we forget that we're asking people to change their lives for months on end. We know that even short-term behavioral changes are very difficult to make.
Yes.
We are asking for incredible sacrifices.
Yes,
and so we have to really, empathize people, because we know that they're struggling, to make these changes. We're denying access to family, to friends, and to the other things that bring joy into their lives. Life is about much more than just stemming transmission of COVID-19. We need to do that. But I think we failed to see that creatively thinking about how we sustain this response is critical critical to the work of containing, this virus.
Yes. And I think part of that means is COVID-0 might not be the goal, and keeping schools open might be a worthwhile trade-off on balance, even if there's a few cases, although not many, I think a few cases that come from that,
Yeah, I'm not sure that I think we need to fight for every last life.
Yes.
I come from a global health background, and, my approach has always been that we fight for everyone and we fight for the most vulnerable first, and I worry about this sort of pandemic nihilism that's crept in. I don't see, a suppression approach as has been employed successfully or relatively successfully in other settings as being incompatible with a public health response that is centered on equity, that recognizes people's fundamental needs for human connection. I think that we can define an approach that gives people the support that they need to meet their needs, including, their social and emotional needs. I think there's been very little creative thinking across the public health community about how to do that. We need to think, what are the supports that need to be in place? How do we structure better alternatives? And I think, recreational activities are important, but they're obviously, I don't want to suggest that they're the only thing that people need.
Yeah, to that end. So this is the thing I'm working on, and you can tell me right now if I'm crazy, and I'll abandon my drafting. But I want to write a piece, and I'm going to call it, and it's maybe somebody will think it's stupid. And I'm confident somebody will think it's stupid. There's always somebody who thinks everything you do is stupid. So fine, okay, thank you, world. But I think my idea, the thing I'm going to write is going to be called A Tailgate Christmas. So I went to college at Michigan State University, big Big Ten farming campus. And, it gets as cold there as it gets anywhere in this country. I mean, it gets cold. And all winter long, we have football games, and it's tailgate season. And what does tailgate season mean? We'd wake up at, actually earlier than we usually do, 7 or 8 o'clock. And we'd go to the parking lot of one of these big buildings, and a lot of people would pull up their trucks or their cars and open up the tailgate. And people pull out grills, and somebody had a deep fat fryer, and they had turkey, and people put out picnic tables. And so, a lot of good food and a lot of good drink. And, you can gather around, people had hot stoves and camper stoves and propane stoves, and we gathered around, kept our hands warm. But, we also, we were college kids, and it wasn't just college kids, of course. It's a huge thing in Michigan. It's people from grandparents to, it's everybody's is at these tailgates, and it's an all day thing. And before the game starts at 7 p.m., although you hope it starts at 3 p.m. So you're still have your senses together for the game if you got all day tailgating. But it's a huge thing in Michigan. I mean, it's like a way of life. People they plan their calendars around this. And so anyway, the thing I want to write is, this is what we should be talking about for Christmas. Tailgate Christmas. It has advantages. You're outdoors. People can distance. Is the risk going to be zero? No, it's not going to be zero, but it's a lot better than going indoors. If everyone's out there doing it, if the people set out some stoves, some heat sources, I think it will be quite popular. It could be even fun, God forbid. Thoughts on this this future op-ed I'm writing that I'm sure is going to blow up in my face. But yeah.
Yeah, I've been thinking about this a lot. How do we structure safer alternatives for socialization and recreation for people? And that may look like tailgate Christmas in Michigan. It might look like bonfire Christmas where I am in Vermont.
Yeah.
It might look very different in a warmer climate, but we need to help people understand what are the real risks. And then how do we structure safer alternatives, to allow them, to enjoy the holiday? We know that, not everything is possible during a pandemic, but some things are. We can help to meet that need at least partially.
So you're not a hater of tailgate Christmas. You kind of like the idea.
No, I actually was. I was actually starting to write something myself, like on this topic, but never finished it.
So you're not going to be offended if I write tailgate Christmas, but I'm gonna include your line about bonfire Vermont. You're okay. You're comfortable with this.
Yeah, I'll send you what I have on this topic too.
You want to work together? Maybe we'll talk about it offline. Yeah.
Yeah.
Oh, that might be fun.
You're going to cut this out of the conversation. You'll cut this out of.
I don't know. Maybe we'll keep it. Why? People want to know how the sausage is made on collaborations. Yeah.
But, there are others that have done really beautiful work on this topic.
Of course.
Julia Margaret.
Of course. Oh, yeah. Julia's the best. She's been on the podcast. Julia's the best. She's written so eloquently and thoughtfully. I mean, more than Tailgate Christmas, of course, broader about, I think she's right. I mean, I think if we had like 10 Julia Marcuses, we'd be in like a different place, emotionally, mentally. I think a lot of the people I've had on this podcast, I think are I mean, that's my bias. I think they're right. That's why I bring them on. Yeah.
Yeah. I think that we also have to socialize this idea among policymakers and leaders. I think that many of them don't, are not familiar with harm reduction approaches.
Yes, I don't think.
And so it's not simply a matter of helping, individuals to understand this, but I think that if we really look, at policymakers and help them to understand these approaches and how they can institute them, at state or municipal level, that, we can have more success. I think, we need to think not only about sort of, home settings, and individual families, but how do we do this, how do we do this in public settings as well? What I would love is for cities, to be sponsoring outdoor activities, to be providing, bonfire pits,
central
outdoor
resources
heaters.
For this, yeah. Put the picnic tables out down the street. Yeah.
Yeah, if you're in a cold climate, set up skating rinks, provide outdoor gear, provide discounted ski passes, provide the support that communities need in order to access, recreational opportunities that are safer than those that they'll pursue on their own. These are things that we can structure and that we can incentivize and make happen. And if we do these things, I think we're going to be able to sustain our response through the winter better.
Yes. As I reflect on this pandemic, I think it would be naive to say it has not affected me. Of course, it has affected me. I mean, I'm a bird that needs to fly. I don't like to be cooped up in the cage. No, it's just, but I don't like to be trapped at home, but I am a lot. And I guess I believe if I were to stand on the side and observe myself, I would say I believe I've become actually much more reticent than I usually am. And you may find that hard to believe because I put out these podcasts. But I mean, in terms of like actual Twitter and such, I a lot of things I don't say that I'm tempted to. And in fact, I clamp down on that. And the reason I've responded, I think, with more reticence is that I'm worried that if I weren't reticent, I wouldn't be who I want to be or who I am. I worry that I'm being pulled in some direction I don't really see because, some of these things are difficult. But to be honest, it's not too difficult for me because I'm lucky I've kept a stable job and I have really nothing to complain about. And I'm actually not as outgoing as I may have led you to believe. I actually watch a lot of Netflix and read books a lot, so I'm pretty much doing what I normally do. And I write, so I'm not a very adventurous person. That was a total lie. But I used to give a lot of lectures for work related things, and I don't do that anymore. But the reason I have this incredibly long prelude is that I think that anguish affects people differently. And one of the ways I think anguish affects people is to view the world through the lens that people who don't do exactly what you want them to do are not good people, they're bad people. Anguish encourages that kind of moralization of choices, that makes everything a moral question. I think anguish makes some people proselytize, people who otherwise wouldn't tell people what to do. They make them people who proselytize and go out and try to convert people, but mostly try to like preach their own choir. And when and anguish makes people very sensitive, looking to be hurt or outraged by the latest infraction, whatever that may be. And so when I look on social media and I look in my feed, I'm sometimes like, oh gosh, I mean, people are really angry about X whatever. Every day there's something else. You know, to be honest, when this podcast will come out, people will think I'm talking about something that I'm not talking about because I actually don't have anything on my mind. But I do see this sort of recurring cycle of outrage, people getting really angry about, some post, some article, some news story, some this, that, the other, something some person did, and more angry about it than I feel like they would if this pandemic weren't there. I think a lot of people just wouldn't care that much. They'd have things to do. So I guess I wanted to pick on this in your mind and think about like, I don't know what the question is. I guess the question has to do with when you place restrictions on people, even good restrictions that are the right restrictions, there is the counter, you talked about this, how do you handle the countervailing things that come from it? And one of those things is anguish. Anguish it affects everybody, I think, to some degree, even if people don't want to admit that they're feeling it. How do you think about that? And how do, and what do you tell somebody to like, I don't know, how do they recognize it in themselves, and what can they do to sort of feel better about it or overcome it?
I think it's really important that we, have a conversation around hope right now, especially. I think hope is how we combat anguish. Hope is something that we have to actively cultivate. We have to work together to create it, particularly at this moment when we're watching just catastrophic loss of life day after day. Yeah. We're watching, a real giving up, go on across this country. And I think that those of us who are engaged in the response to the pandemic in various ways really have to come together and think about how, in, a really dark time, how do we reimagine what's possible? How do we, double down with really creative approaches to get as many of us across the finish line as possible, and I think how do we, and we have to do that collectively, but then we also have to think about how do we cultivate hope, within our own spaces, whether that's within our own communities, our families, our social networks, that's the only antidote to that type of despair or anguish I know is hope, and hope is not an easy thing. I grew up in the global health movement. I began my work in Haiti and, at, a really difficult time, and came to learn that the way, the only response we can have, when we see the type of loss of life that we're seeing, and it's something that I experienced, when I started in human rights work, is we honor the lost by just fighting, twice as hard for the living. And that's what we're going to have to do, to get to the end. It's not an easy moment, but that's, I think where we're at.
That's well put. I was tempted to say that I think the great hope has come, which is this mRNA vaccine and vaccines, which is great. But I worry that there's some people who find a way to diminish the hope by excessively dwelling on all these people who not gonna. They're like, the vaccine is like, well, like I want to pop champagne, and everyone's like, these people are not gonna take it. I'm like, oh, quiet about that. They're gonna take it eventually. Yep.
Yeah. I think that I think that many people will take it.
Yes.
We have to. It's gonna take a lot of work to get there, and a lot of humility to find the right way to do that. And my call is for humility and for listening right now, to think about that.
Yes.
But what's really important for me is for us not to see the vaccine as, an easy out, for what needs to happen. We need as many people alive to get that vaccine as possible, over the next several months. So this is a moment for us, to see vaccine equity, not simply as a matter of, finding all the arms we can jab quickly, but really thinking about how do we get as many of us, to that finish line as possible.
And Sosin, it's a real pleasure to talk with you.
Thank you for having me again.
You've been listening to Season 3 of Plenary Session. Plenary Session is produced by Kiana Klossner. Music by Ian Straley and Audrey Tran. The views expressed on Plenary Session are those of whoever said it and no one else. Plenary Session is not medical advice. Follow us on Twitter at plenary_session. Until next time.